Elenio. Today we're going to just be doing a regular cataract surgery. So the first thing that my dad is... Oh, by the way, I'm his son. I'm not just some random kid they pulled off the street. We're going to be doing two incisions into the eye. No, it'd be like more like this for you guys. Yeah, like that. And he's then going to be putting in antibiotics through this one. And then he's going to be doing a capsulorhexis in this one. And through the capsulorhexis is where he makes a circular hole in the film. He's going to use some tweezers to make a little catch in the film. And he'll use the tweezers to pull it around and make a circle. Then he'll use something called the phaco handpiece, which is like a little mini vacuum, to sculpt a groove through the cataract 4 times, putting it into 4 quadrants. And then he'll eat up the cataract with the phaco handpiece. And then he'll put in the lens and then polish for a couple minutes and be done. So, I'm going to invite him in. Dad, you here?
Yep, I'm here.
Okay.
I want you to look straight ahead, right at the lights. Just kind of wiggle back in there. And we'll open the capsule, just like that. It's interesting, kind of.
Blue and pink.
Blue and pink, that's right, okay. Thanks. Now I want you to look directly at the square-shaped light.
Okay. To
Perfect.
anything. It's fake. Don't actually
Keep
need it.
staring at that light.
I just wear it for fun. Like that. There you go. Now you can see I'm wearing a mic even though the mic's not on.
Okay.
Okay.
Oh.
So
Need a little more viscoelastic.
I think.
The cannula would be wonderful, as long as there's no bubble in it. So I suppose the one interesting feature about this case, if anyone cares, is that this patient has a history of narrow angles. And there's a peripheral iridotomy right down here. So, you know, in between cases when I go to the laser and I do a PI, I'm going to do, and it's so tiny. Can you see that little orange? Oh my gosh, you guys probably can't even see that. Well, trust me that it's there, I guess. But the reason that's relevant is that narrow angles mean that the whole front part of the eye is just really crowded. So that's why I stopped there to put in a little extra viscoelastic, because otherwise you got no room to work. And everybody needs a little elbow room. What's that, Eli? Is that I have an earpiece in my ear, and my son is talking to me because he's narrating your video.
Oh.
And if you have time later, I know you probably...
My son's got
You might have mixed feelings about watching this surgery, but I would encourage you to do so, because Eli is really cute when he narrates these things. Probably doesn't want me to say that, but it's just really true. And sometimes we have a little bit of banter. He thinks he's funny. That's the...
Banter.
Soma, can I get a little irrigation? There's just like a little bubble in the goniosol. Thanks.
I don't like bubbles.
Eli knows I don't like bubbles.
I don't like them either. They ruin it. It's not always fun when there's a bubble. They are not fun.
Yeah, they make it hard to see, don't they?
Okay, right now he's using something called a phaco headpiece to sculpt a groove through the cataract. Then he will probably divide it into 4 different quadrants and use the phaco headpiece to suck them up individually. There will be no more cataract. And then after he does that, he will put in a lens and be done. There's a little bit of things like sealing it up afterward, putting in antibiotics, but that's pretty much all.
All right, that's 25%. %50.
Dad, I saw the stream, and I was like, oh, somebody commented. I was like, oh, that's awesome. But then I realized I commented. I saw the green, and I was like, oh, did somebody subscribe? That would have been great. Oh, by the way, like, share, and subscribe. And it was like a comment, and I was like, there are no comments. I was like, except for mine. Oh.
Yeah, we don't really have much of a viewership on the YouTube channel.
It's usually just the people who,
Yeah, we need some subscribers, you guys. I need to get all my nurses to subscribe. Did you? You're so nice. Thank you for subscribing.
What's the name of the channel?
Eugene Eyecare. Yeah. Like, let's say you're at work. It's like your day off. You get a notification that we're live. Wouldn't that be amazing? So you can spend your day off watching eye surgery.
subscribing actually helps out the channel, but turning on the notification bell to see when we have a next video is even better, because then you will never miss a video. And you can thumbs it up. Looks like the little bubbles look kind of like eyes.
They look like eyes. So,
Little square eyes.
uh-huh. Some people say the lights look like marshmallows.
Yeah.
Or,
I want a
gosh.
marshmallow now.
Is that making you hungry?
Yeah.
Did they let you eat before this?
I didn't eat.
I know, Vicky doesn't like people to eat.
Oh, thought you were
It's a little
talking to
power
me.
struggle we
And
have.
I didn't take any of my maintenance meds either.
Oh,
No.
oh, well. That's
Hey,
good.
Dad,
Yes.
let's talk about something.
What do you want to talk about? Eli's talking in
even
my
know.
ear.
I don't even know. This is number
All right.
03? Yeah. Yeah.
Okay, what do you guys think of that? Does that look nice and clean? They have to say
Yeah.
yes because they work for me. Did I miss any spot? You can say, Doc, you missed a spot. I was
Doc-
testing you. There was still a
Doc,
spot
you
I needed to
missed a
clean.
No, he ignores me. As usual. Okay. So right now it looks like he's just cleaning up and did you already put the lens in? Yeah?
Oh, look at that. Look at that little string that wants to come.
Yeah, did you already put the lens in?
Yeah, the lens is in there.
Yeah. So
I'm
he's
just
just
putting the
smoothing it
polish
out.
on.
This is number 3, surgery number 3, so if you are on the wrong surgery, your one's probably like next.
This is case
That
number
was
3.
kinda random.
Yeah, it's case number 6 that canceled. Thanks. This one's got a, not quite sealed, so I'll have to hydrate it again. Usually we get them on the first try, but not always.
Oh, let's tell them about my new jacket.
Go ahead.
I got a new jacket yesterday. I got it just for this. I can do this.
Okay, that looks good.
Boom.
Okay, we've got some antibiotics for you right here.
Yeah. That's some BSS to
Good.
help seal it up, make it watertight.
Okay, and here's the little catalog.
Yeah, looks like we're just about done. So, I might
This part
express this a little
sometimes
bit, but
stings a
remember to
little,
like,
like
share, and
you're
subscribe because it
feeling
really
something
does help out the
normal.
channel, even though it's
All right.
a little bit. Every little bit helps.
All right, looks good.
So, thanks for watching.
Okay.
Good.
I think you're going to notice a huge difference.
We finished up. We're going to be doing another surgery in like 3 minutes. If you want to watch,
Any questions?
And
see
You're
you
awesome.
in a couple
Thanks, Jan.
minutes.
Proud of you.